joining our physiotherapists.
What?
The people
Sorry.
that do you hear me?
Yeah, I hear you now.
Okay, the people that they're coming into this meeting are physiotherapists, physios.
Yeah, all of them are. Doctor, you share the PowerPoint?
Nehal,
Yeah, I'm with you.
can you can you hear me, or we have a connection problem?
No, no, now I can hear you clearly.
Okay, okay. In case you don't hear me, you tell me, okay? Or write to me.
Doctor, we will start at 9 and 5 minutes.
In 5 minutes? Yeah.
Oh, yeah.
You tell me whenever you're ready. Okay. I'm gonna take a glass of
Okay.
water. I'm coming, okay?
Okay, doctor. Okay, doctor, we can start now.
Okay. We will present craniosacral therapy for physical therapists, and welcome for everyone. It's an honor to be here and present this for you. My name is Kyriakos Karabatsiakis. I'm an occupational therapist and the director of a Pleasure Institute and Baral Institute in Greece and Cyprus. Do you want me to share my screen? Let me share my presentation. So the title for this is how gentle techniques of craniosacral therapy can deepen your clinical impact. Sorry about this, a small glitch. Let's go to the next one. My name, as I said, is Kyriakos Karabatsiakis, or you can call me Kiri, or Dr. Kiri, whatever you like. Today's goal is to introduce the craniosacral therapy, or CST as we say, the abbreviation, and specifically how it can benefit you as physical therapists. I know that everyone is physical therapist, and I'm really glad that you joined. So a little bit about the Pleasure Institute. First of all, about me, I would like to say that before we dive in, I would like to introduce myself. I'm an occupational therapist for 25 years. Uh, I was specialized in pediatrics, especially with people in autism and developmental disabilities. And I started using craniosacral therapy in 2010. It was my first seminar. So it's like 15 years that I use craniosacral therapy. I took the first course in Greece, in Athens, and then I traveled to US and Florida state in Palm Beach Gardens, where is the Pleasure Institute International, and I took all the courses for the basic training up to the advanced courses, also the pediatrics course, and the craniosacral therapy assisted by dolphins in the Bahamas, and some other courses. And I had the privilege of training hundreds of professionals across various disciplines, physiotherapists, um, speech therapists, osteopaths, massage therapists, medical doctors, dentists, orthodontists, and vets, and other professionals that they come to our courses. Our mission at the Pleasure Institute is to offer high quality, hands-on training. We're manual therapists, and we train in manual therapy, and our goal is to empower the therapists to make a deeper impact, to make their skills better with their clients. So the Pleasure Institute was founded by Dr. John Pleasure, who was one of the osteopaths in US that he made research. He had incredible miraculous work. And in 1999, in 2000, the Time magazine had the cover of one of the best people in the 20th century in alternative medicine is Dr. Pleasure. We are the global leader in craniosacral therapy education and training around the world. We are in more than 60 different countries in the world, and more than 250,000 people have been trained in craniosacral therapy around the world. I am the sponsor. I'm the representative in Greece and Cyprus for these courses for Up Ledger Institute and Baral Institute, because when I started in 2015, uh, they proposed to me to take over the Up Ledger Institute in Greece. In 2018, I took over the Baral Institute in Greece, and a little bit later in 2020, I took over the sponsorship also in Cyprus. So a little bit about this is him, John Upledger, and what is craniosacral therapy, which is the topic for today. It's a gentle hands-on technique that was developed by the osteopath and physician Dr. John Upledger. It works by releasing restrictions in the craniosacral system, which include the membranes and the cerebrospinal fluid that surrounds the brain and the spinal cord. And we use, this is the most important, we use a very light touch, which is about 5 grams of pressure, because this is the force that John Upledger found that is enough to connect with the fascia, feel the restrictions, and also it's somehow under the radar of the body. So we don't induce more force because we don't want the body to resist. This is the reason. And so with using these gentle techniques, we can feel the very soft tissues around all the structures, ligaments, and our main goal is to release restrictions around the central nervous system, around the spinal cord, and in this way we support the self-healing mechanism. Our body has a self-healing mechanism that knows what to do. Let's say if we cut our hand and we make a wound, our body knows exactly what to do, even if we do nothing. If we don't make stitches, if it's not very deep, the body has a very, very complicated in a way, if you see it in how the body reacts, but it knows how to self-heal it, and after maybe 5-7 days, it's healed. So this is what we support, and we see that this modality, this method of healing has great results. But this is the craniosacral system. You can see it's the intracranial system inside the head, and all the dural tube, all the dural membrane around the spinal cord, and at the exit of the nerves on the nerve roots. There's also the meningeal sleeves. So we work with this system. But why a physical therapist can use craniosacral therapy? You might wonder why, what we will add, what are the benefits for you. First of all, CST addresses the underlying restrictions that may not show up in a standard musculoskeletal evaluation. Also, access deeper layers of dysfunction. and it's ideal for patients with chronic pain. I guess you have people with sensitive or chronic pains that the same problem appears again and again. If you, even if you work with it and it feels that they have a result that stays for a week or 2 weeks, then they come back with the same pain. Okay, so it's ideal for patients like that. For patients that they have headaches around the cranium or a whiplash injury, dysfunction of the TMJ, uh, people that they have tension after a surgery, and even in neurological disorders or stroke or any of the neurodegenerative diseases like Alzheimer's, Parkinson's, and so on, MS. It supports the nervous system and the regulation of the nervous system. And also it's very good for all kind of people that they have anxiety. Do you know anybody that has anxiety, or people that they have insomnia, people that they have their sympathetic system, it's very high, huh? All the people that they live in big cities or under stress, under the stress of the work or with the family, all these people they like to find ways to relax, to have a better sleep, a better digestion, and also it enhances recovery after any kind of trauma or surgery. And for people that they like to have uh, prevention, as we say, prevention is the best therapy. So for people that they want to have a well-being, emotional and physical well-being, it is the most important to take one session of craniosacral therapy every month or every 2 weeks. So some people that they can afford it, they put it also in their every day or every week activities. So, do you have any questions until now? Or I can continue. What conditions the craniosacral therapy can help with? As we said, it's beneficial for headaches and migraines. It's something that I see very often in my clinic. Uh, People that they go also into pathologists, doctors, medical doctors, and doctors say, take a pill, I don't see anything in MRIs or in X-rays, so you don't have anything, important, or it's in your head, it's emotional, take some pills. But these people, they cannot live with pills their whole life. So they come to me and meet me because they know I can help them with headaches and migraines. Also, uh, chronic neck and back pain. I guess as physiotherapist, you will have a lot of people that they have chronic and back pain. Uh, Concussions and whiplash. We see that very often after car accidents. Postural imbalances. Some people also, because of the work and they sit a lot on a chair the whole day, or they have some postural imbalances, and chronic fatigue or fibromyalgia is one of the conditions that I usually see. I also see people with tinnitus, um, people with vertigo, neuralgia, trigeminal neuralgia, or all kind of neuralgia, and also craniosacral therapy can help, as I said, with kids, with children. It was my first goal to help the children that I was treating as an occupational therapist. This is why I started the craniosacral therapy. And I saw that working especially with autistic people, I saw some of, some miracles happening. People that they couldn't speak start speaking. Um, People that didn't like to touch other people or hug their brother or their sister after craniosacral therapy, they start wanted to be hugged. This gentle touch that we induced with craniosacral therapy then started, for these people to want to have it from their environment or in the school. So slowly they become more social, and they start also the communication verbally and non-verbally. So it's amazing how you can see a lot of things during the practice. And what will add for you to your practice, um, first of all, will the craniosacral therapy complements manual therapy techniques. So if you use any manual therapy techniques, this also comes in addition, and you have a lot of tools into your toolbox. Opens up the tissue and the nervous system responsiveness. So also it's a way that you can go deeper into the nervous system. Uh, Often accelerates the recovery, especially in cases where you don't have any progress or you feel that there's a plateau. So in these cases, you have an extra tool to make the people benefit a little bit more. Many physiotherapists report that patients become more receptive to other treatments after receiving craniosacral therapy. And also, you have another tool to promote relaxation and recovery for all your clients. I want to say that there is a department in Apledger Institute International that supports us, and there is a growing research supporting the benefits of craniosacral therapy, especially in areas like chronic pain, fibromyalgia, concussion recovery, and pediatric conditions. For people that they are interested into the research and the articles, I will send to the organization, all the organizers, and everybody will have some links, so you can take a look about all the research that they uh, we collect all the research, not only the research that we do, but other scientists do all over the world. So we collect all the research and clinical studies, and we continue to encourage people to go on research and find the results in peer-reviewed research and clinical practice. So I would like to share a real case example. I had a client that had a problem with his shoulder. He was trying to recover from an injury, and after months of physiotherapy, uh, his progress was really slow. So the physiotherapist sent him to me, and with implementing craniosacral therapy, we discovered significant tension in the upper cervical spine and the dural membranes. So after 3 sessions, the pain was reduced and the mobility was improved. So I sent him back then to physiotherapist, and he resumed his physiotherapy with faster results. So this way, collaboration between the physiotherapist and the craniosacral therapist uh, benefited the client, and also the physiotherapist had all the credits because he could give him the better results in less time, which is very crucial. So after this, the physiotherapist decided to participate in our training. So, and all his team. Um, so about the training, I said about the research before, how to get started. And if this resonates with you, the good news is that craniosacral therapy is something you can learn and start using right away. Our courses, the first level, CST1, we have 4 different levels: CST1, CST2, Somato-emotional release 1, Somato-emotional release 2, and the advanced course. So 5 if you want to go also in advanced, if you want to do the whole curriculum. I propose that if somebody wants to do, let's say it's like the elementary school, you don't go only to the first grade. If you want to learn, you go to the whole school, to the whole all the classes. So this was also my goal. I had the goal to start with CS1 and go until SCR1, SCR2, so I could do the pediatric course. Then later I discovered that I had to do more and more. But the thing is that with the first course, which is 4 days, and it's a hands-on course for professionals, you learn the very basic techniques and a 10-step protocol, as we say, and you can implement it right away into your practice. And there's no cranial experience that is required for this class. And the other thing that we do right now in Greece and Cyprus, and it's for everyone worldwide, we break it into these 4 days into 2 different weekends. On one weekend, we do only the theory, and it will be online. So you take 2 days online, only theory, maybe from Zoom or Teams or whatever apps we use. Usually we use Zoom. And the other 2 days, it will be with physical presence because we're going to teach you how to use your hand. So the people that they have done the theory before, we gather for one weekend, Saturday and Sunday, or Friday and Saturday, for 8 hours every day, and we do all the techniques together. It's 21 techniques, but if you put it together, we have this, as we say, the 10-step protocol. And after this, you can implement it and integrate it into your practice. These courses are offered in Greece and in Cyprus in small groups, and there's always some practice and some of my teaching assistants and me that we will guide you to do the practice. So I don't know if there's anyone that would like to do it from Egypt or any other countries, but we can discuss with the organizers, and if we see that there's a, a group of people that they want to do it online, and then they want to do it the part with this physical presence, we can arrange it and see how we can do it. Maybe I could travel also, instead of 5 or 9 people, 10 people travel from Egypt to Greece. So this is a little bit about the craniosacral therapy. as a start. I would love to hear from you. And one of the questions that I would say is, have you ever experienced craniosacral therapy? Also, any questions about do you have any patients that might benefit from a more integrative approach, integrating craniosacral therapy with physio? Or any other questions about how it could work alongside with your current treatments? So I'm open to any kind of questions.
Yeah, I am still a student. I'm still a PT student. How can I benefit from this technique?
You can benefit in many, many ways. First of all, we dive into the anatomy of the nervous system, of the brain, and the surrounding membranes of the system, the dura mater, arachnoid mater, pia mater. We see the craniosacral, the cerebrospinal fluid that nourishes the brain and the whole craniosacral system. We check all the dural tube into the spinal cord from the head to the sacral bone, to the sacrum bone, and then we go step by step, and we see first all the spinal cord, all the spine. We free up with the techniques that we will learn all the diaphragms, the pelvic diaphragm, if you work with pelvic diaphragm, the respiratory diaphragm. We open up the thoracic inlet here, the hyoid bone, and the between atlas and occiput. So after we open all the diaphragms, we can use the bones as handles, and we can put a traction into this soft tissue, which is the membranes, the dura membrane, and the other membranes that they support the brain. So this is an osteopathic treatments, osteopathic techniques that usually if you are a physiotherapist, you have to spend a lot of money and a lot of work and a lot of study to do an osteopathy school. Uh, with craniosacral therapy, we go and we learn how to manipulate the meningeal part, one of the parts of the osteopathy, the cranial part, and also it's very nice to find if you want to say, to find the connections between the spinal nerves and the nervous system with the musculoskeletal system. I know that physiotherapists, they like to work on the muscles, on the bones, on the joints, but all the information that comes from the brain, from the nerves, how you can support them, how you can regulate the nervous system, what to do if you have a muscles with spasm. Sometimes you work on the muscle, you find it that it's a little bit more tender, it goes a little bit more relaxed, the patient goes back to his home, and the next day he calls you and he says, oh, my muscle, it's in spasm again. Why? Why? Where is the root cause of the problem? Where is the root? So this is what we try to do with craniosacral therapy. We try to find which is the nerve irritated or the spinal segment that is facilitated, irritated. So we try to find the root of the cause, not only to work on the shoulder, let's say. Okay, the shoulder, it's the symptom, it's the shoulder, but where does this start? Is it in the cervical spine? Is it in the brain? Is it a little bit lower? So we try to, is it on the gallbladder? The gallbladder is innervated by the phrenic nerve, and the phrenic nerve also is responsible for the brachial plexus. So we find all these connections. It's really important for you as physiotherapist to know all these connections in the body, and you know how to treat them. Does this answer your question?
Yeah. Thank you.
Thank you, Omar. Anybody else? I would like to hear you. I know that you have a lot of questions. There's no stupid question. If you think about it, ask it. Maybe also some other people, they would like to, they have the same questions in their mind. And if you ask this question, I can answer, and I can answer to many people more.
Is there any contraindications for applying craniosacral therapy?
Thank you. Nadine? Thank you. Yes, there are some contraindications. So if someone is diagnosed with high intracranial pressure, we don't treat. We would like not to treat. Also, if they have a stroke the last 30 days, okay, if it's an acute stage of a stroke, people that they have aneurysm, brain aneurysm, and some people that they have a very soft tissues around the occipital bone, like people with syndromes, some kind of syndromes, spina bifida, things like that. These people we would like not to treat, especially if we are in the first level of education. If you have people like this, you may recommend them first to some senior advanced craniosacral therapist like me, or you just communicate with the doctor and tell them, that your client has come, he has higher intracranial pressure. I know that it's in contraindication. So if you have a neurologist and he wants to back up you, it will be okay. But generally, we would like to avoid this kind of situations.
Thank you.
You're welcome. You're welcome. Something else that you would like to ask about craniosacral therapy?
Can it improve the physical modalities like electrotherapy?
Can you repeat the question or write it in chat, because I didn't understand?
If it used with electrotherapy, can it benefit the patient or what?
If we use it along with electrotherapy,
Yeah.
Generally, craniosacral therapy is a complementary alternative therapy. So that means that we can use it with other therapies together, let's say. So you can do reflexology, you can do physiotherapy and craniosacral therapy. With electrotherapy, it's no problem. Usually, I was as a very young craniosacral therapist. The first 3 months after my first course, I went to a physiotherapist in Crete, in the island of Crete, in in Greece, and I had all the patients that the physiotherapist would see. They would come to me also and have a session with me. So after an electrotherapy on the knee, I start working with the patient with my hands, and I say that, I share that information because I could feel the electricity still in his muscles, in his joints, and slowly, I could feel the electricity in my hands. And this was not very pleasant for me as a therapist, because I could feel like my hands were like in a shock, but I had it, for 1 or 2, 3 minutes. I had to wash my hands or take out this unpleasant sensation. And when I put my hands back on his knee, I could feel that the muscles were more relaxed, and then I could work more and more. So I'm not really sure how exactly the electrotherapy works, because I know that you put a device that sends some electricity, but let's say for my knee that I had, let's say, an injury, and I'm 50 years old, 49 years old, and I had a small injury. You put this to my knee for, let's say, 5, 10 minutes, and then another person comes that had, a surgery or a replacement or whatever, and he's 80 years old, and you put again 5 or 10 minutes of electrotherapy. So it's like you have the same protocol. I don't know. I'm just assuming that you have a protocol of doing electrotherapy, and it's like for everyone it's the same. But in craniosacral therapy, the thing is that it's tailor-made. Our hands are the only tools that we use, and the body knows exactly how to use them and what to do. So this is, I think these are more intelligent than any other device we have right now. And the body accepts the touch, the gentle touch of the hands much more easier than X-rays, electrotherapy, laser, or whatever. This is my feeling. This is what I believe. I have done it for many years, and I'm talking from my experience. But if you know, for sure, you know more about electrotherapy, so you may tell something different. Does this answer your question?
Thank you, doctor.
Thank you. So I
Doctor,
see. Yes, please.
does there are any possible bad consequences that may happen due to this technique or therapy?
Possible consequences?
Bad consequences, yeah.
You mean something that it's not going well, or it's not going bad as
Yes,
it
yes.
should be?
Yeah.
So the thing that we see sometimes is that are people that they come, and after the session they feel tired. They feel tired. They want to sleep. They want to go. Maybe they go to sleep and they sleep like for 10 hours, 15 hours, and they don't experience this very often. And I tell them, if your system it's in the sympathetic tone is very high and chronic, you are exhausted and you don't know it. So when your system with the craniosacral therapy goes back into regulation, into the parasympathetic system, then you might feel that you need to rest. Your body wants to rest, and you feel exhausted, because before you couldn't feel it. Your adrenaline was so high. You had a lot of hormones because of the sympathetic tone, and you couldn't feel actually that you were drained and exhausted. So after craniosacral therapy, some people feel like that, and the opposite happens. Some people after a session, the first session, they may feel that they have a lot of energy, or they want to go around, they don't want to sleep, they have a lot of energy. So sometimes it works from this or the other side. Rarely you can have a therapeutic crisis, as we say, that some symptoms may flare up. They might come from a shoulder problem, and the shoulder problem or the pain is gone, but then after 2 or 3 days they may feel a different pain in the body, that it was like 3 years ago that they had this pain, and they thought that it was disappeared, and now it's coming back again. But for me, this is like the body goes, we go in a different layers. So we treat something that it's more in right now, something more recent, something more in the surface, and as this disappears, we may see something that is deeper, or maybe also the root cause of the problem. So only these things is that I usually see. The thing that we use only 5 grams as a touch is very crucial, because this makes us safe. So we can work with babies that they have been born like for 2 or 3 days, or the same day that they're born. You can work with very, very light touch, and we work with all kind of conditions, and until the end of their life, or people that they want to die, or they're in a hospice center. And we use very, very light touch. We work with pregnant women, and everything is okay. So I don't feel that there's anything bad that you can do, anything abnormal, let's say. Is that okay with you, Huda?
Yes, thank you.
You're welcome. I see another questions here. What are the prerequisites for CST, or preparations? Prerequisites. We want you to be a professional in any medical or paramedical profession, like a physiotherapist, speech therapist, occupational therapist, reflexologist, acupuncturist, or any kind of these modalities. And you should prepare yourself by reading the Inner Physician in You. It's in English. We have it in English, where Dr. Apperledger describes how he found the craniosacral therapy, because this is an evolution from the cranial osteopathy. So he made the research, and he also talks about some cases that he had. And for the first level, we would like you to read the Craniosacral Therapy book, the brown book. I don't have it right now to show to you, but it's a brown book with many pages. It has all the techniques that we describe in CS1 and CS2 levels. And if you have it and you can read in English, you can read it. If you don't have it, it will be okay, because we will cover all the material, and we give you a big study guide. It's a study guide with 320 pages, illustrated with all the techniques in illustration in different versions, like from photos with real bodies, with diagrams, and also there's the description of all the techniques, and also some white pages that you can put your notes there. So in each level, we give you all the information needed, and the manuals, these notes, let's say, of the class. So this is the preparation, and also a little bit of anatomy. So I will send you some anatomical terms that you need to search, look, find the atlas, the Netter atlas, or whatever atlas you use, or just go online in Wikipedia, find your physiotherapy books of anatomy, and check some terms that I will give you, like dura mater, or I will send you these anatomy terms that you have to look for. So when we do the course, when we do the practical, or we do the theory, we all speak the same language. Thank you for this question. So anything else you have, I'm open to hear you, because I see 95 people we are here. It's amazing. Thank you for the honor to be here as a lecturer.
What is the most important technique that we should learn about?
Nah, I like this question. What's the most important? Eh? I'm not sure. With all the techniques, look, all the techniques are important in a way. So Dr. Jonah Pledger decided to put all these techniques in a sequence. We start from the first one, then we do the second one, then the third one. But each one of the techniques helps the next, and the next. So this is how he did it, you know. One of the techniques that we use in the beginning of the session, the start of the session, and at the end of each session, when we use the 10-step protocol, it's the still point. We induce a still point. And what does it mean, a still point? It means that our body has this cardiac pulse, has the breathing, the respiration, the breathing rate, but also what we have is the craniosacral therapy, the craniosacral rhythm, the cerebrospinal fluid, the production and the absorption of the cerebrospinal fluid produces a very fine, a very thin, a very subtle pulse on the nervous system that we can feel it by using our hands on the skull or on the body. Okay, I will teach you how to do it. This is on the first level. So we feel first the craniosacral rhythm on our head, on our shoulders, on our thighs or the legs or wherever. And then when we feel this rhythm, what we can do a still point. So we induce with our hands, we say to the system, now you can relax, 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 and in a way, the rhythm stops, or we don't feel it anymore, or we don't feel the change of the fluid, of the pressure of the fluid. So, and this stops for the system decides from some seconds or maybe 1 minute, 2 minutes, and then when it starts again, it's so different. It's like a new wave that is coming, which is more vital. It helps remove any metabolic waste. It helps small tensions that we have in the fascia to move away. And we can use this technique to babies that they have fever and they have a plateau, like they have like 39 or 40 degrees. And if you use this technique 2 or 3 times in a sequence, you see that the fever drops about 2 points of Celsius. So maybe from 39, it goes to 37. So this is a unique technique that we use in craniosacral therapy. And another very crucial technique is the occipital cranial base, the disimpaction, let's say, the decompression of the atlas from the occiput. I think these are some of the most important techniques that everyone can practice, can use it in their practice, in their clinic. Even for only these two techniques, the still point and the decompression of the atlas, you should do one of the classes. Is it okay with you? Nadine, you were,
Yes, thank
you're welcome.
How 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 exactly do you feel the electricity of the brain or the body?
How we can bring down the electricity?
No, how 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 do you feel it?
How I feel it? It's very interesting question. I- I'm I'm not sure to tell you how. I put my hand in a, around the brain, around the skull, and I try to connect first with let's say with the skin, and then with the fat tissue, and then with the bones, and then inside the bones the dura mater. And if the body lets me go a little bit inside on the brain, and usually when I feel something like electricity, it's like my hands are tingling, like like I don't know if you have feel electricity from the plug. If you have put your fingers in the plug, I have done it when I was a kid. I was playing with the plug, and at some point I was hit by the electricity, and I remember this feeling that all your body's like that. I was very lucky that I was not killed, but this is how you feel a little bit the electricity moving into your hands. But this is not something that we usually um, practice or we do in craniosacral therapy. I just mention it because I had a client that he has done electrotherapy in the physiotherapy clinic, and then I used my hands on the same uh, side, on the knee, and that's why I felt still the electricity in his tissues. Usually, the electricity of the brain is so small, it's very little. Only when I have people with seizures, with epilepsy, then you can feel that a place on the brain is accumulating a lot of charges of electricity, and at some points when it discharges, then it's the time that they have the epilepsy or the seizures. So this is something that sometimes I do craniosacral therapy for this kind of children, and it helps a lot. I have great results with epilepsy. 99% of the children, they have less and less seizures after craniosacral therapy.
I didn't quite uh, understand, but like you feel the electricity of the body through like, through through two layers of skin. So how like the physics does not connect here.
You didn't quite understand what I said, but the thing is that when I put my hands on the skull, let's say, I try to connect, okay, with all the tissues around here. I go into different levels. So I put my intention first on the skin, then I put my intention a little bit deeper. Then if you put your intention deeper, you feel the bone, and you can feel also inside the bone if you want. Okay, this is how we start by using the palpation to feel different levels of the body. This is something that you can learn also in craniosacral therapy, but also in visceral manipulation when we put our hands on the abdominal cavity and we dive first from the skin to the fat tissue, then we find, let's say, the stomach, then we find different parts of the stomach more deeper, and then we go even into deeper layers so we can feel the pancreas, or we can feel the spleen, or we can feel the kidneys behind posterior of the stomach. It's something that you can learn. It's some skills that you can slowly adapt, and it's like, all this, our hand is very powerful. It's like the knife. If, let's say, if you have a knife and you don't use it, you may have it, but it doesn't cut. But if you use it and you always make it a little bit more sharp, a little bit more sharp, it can be so sharp, like the knife that they use in surgeries. So it's always like that. Think about like that. You touch sometimes, and you touch and you don't feel the cardiac pulse, but you put your hands here, and sometimes you say, oh, there's no cardiac pulse, but the person is alive. So you have to adjust your pressure to find the exact position where you feel the most information from the pulse. So it's kind of the same. Slowly we learn where to put our hands, where to palpate, how to connect deeper and deeper. And of course, I started using my hands 15 years ago. So each student, it's different, but some people, they start from a point, and slowly they progress, and they have the palpation more and more into their practice. Does this answer your question, Omar?
Yeah, so it's basically it's like the beginning experience through multiple practices, right?
Yes, yes, yes. You get experience. We start from some starting points. We say exactly where is the hand placement for its techniques, but we need practice. And during the courses, we practice 1, 2, 3, 4 times to different persons, okay, in the class. But the most important is to put it in your clinical practice, and then you learn a lot from your clients. Each client, each patient, it gives you a new information to your hand. You are in a good level, but your hand always takes new information. It goes to the brain. New neuronal paths, new circuits are always there. Every time you feel a different body, you have or different day on the same body, you have a different sensation. So each day, each client gives you an opportunity for a lesson, and also an opportunity to make your palpation even better.
Okay, sir. Okay. Thank
Doctor,
Yes.
thank you much.
in case of chronic pain where structure finding are minimal, how do you differentiate between central sensitization and subtle craniosacral restriction?
Can you tell me one more time the questions, because I have some problems with the connection
Okay, in case of chronic pain,
of
where
chronic pain? Yes.
yes, where structure finding are minimal,
Mhm.
How we can differentiate between central sensitization and subtle craniosacral restriction?
We learn that it's very nice, this question. I like it. We learn in the first course, we learn more about the techniques, and we have only one tool to use for finding restriction, which is the craniosacral rhythm. On the second level of craniosacral therapy, we use the whole body evaluation, so we can find different lesions in the central nervous system or in the peripheral system, and then we can use 4 different tools: the facial glide, the craniosacral rhythm, arcing, which is something unique that we use and you will find out in the second level of craniosacral therapy, and facilitated segments. We use these 4 tools, we combine these tools, and then we can differentiate if the pain is more because of the structure, or because of restriction in the craniosacral system. Does this?
Thank you. Thank you, doctor.
You're welcome. Mohammed, we have
Which neurologic condition? Which
again.
neurologic condition? Which neurologic condition is the most responsive to the craniosacral therapy? The most responsive.
Yes. Look, many of the conditions, I wouldn't put it in small boxes, because every client is different. So if we put the clients into big, categories, like this client is MS, or this client is stroke, it doesn't help us actually. What it helps, is that to connect sometimes with the client. As I said, each client is unique. I like to take the record, the history from each client, his background, what are his injuries, surgeries, dental procedures, what is his work, how is his posture, everything that I can collect. Okay. And then, okay, I know that there is a condition there, as you said, a neurological condition, but the real information comes when I touch the body and I do the evaluation with my hands on the body. So then the body starts to speak to my hand. And then if I listen very carefully with my hands, I know where to place my hands, where to start the craniosacral therapy, where to start my therapy, how to support the body and the self-healing mechanism. So, of course, I don't say that we can do miracles with everyone, but it's incredible when you see children thrive. I mean, also autism for me is a neurological condition. Seizures are neurological conditions. I see people with multiple sclerosis to somehow stop the progress of the condition and be on the same spot, or even a little bit better than they were, and the doctors, they don't have explanation about that. I see people after stroke to rehabilitate even faster and stronger. I see people that they had knee injuries that doctors, orthopedic surgeons said, now you have to do the surgery, and they do craniosacral therapy treatment for 2, 3, 4 months, and then they don't need the surgery anymore. So for some cases, I have seen great results. That's why I believe in craniosacral therapy. And also, very, very important for me, for physiotherapists, is how you treat your patients, how you treat them, and what are the results, or what are the results with the difficult people. Huh? What are the results for the difficult people? So you have another tool in your toolbox, so you can say, okay, let's say we work with the devices, with this with the laser, with everything. Let's try something else. Do you want to try? And you can do craniosacral therapy, and then you can see that the results are even faster. And people, of course, you may think that, oh, maybe if I finish with him so fast, I will not see him 10, 15 times. But the most important thing is that he will send you all his family, all his friends, because what you're doing is so different from any other physiotherapist. I don't know if I I can. If you let me here, I can speak until midnight or even later. I can talk about craniosacral therapy, for free. It's amazing.
Thank you, doctor.
You're welcome.
Doctor, please.
Yes, who is
If we
speaking?
have a case, yes, if we have a case that contraindicated for sacrospinal therapy, craniosacral therapy, sorry. What is there any other solutions to manage this case?
We have to know our limitations. So if somebody comes and let's say he has a higher intracranial pressure, or the pressure of cerebrospinal fluid is high, and you cannot treat him, it's a limitation, but it's okay. It's like we treat 99.5% of the cases, and we don't treat 0.5% of the cases that they will come in our office. So for me, it's okay. I cannot treat everyone, but I tell them, in this case, you have to talk with your neurologist. So for me, it's okay. We have to be fair. We have to be sincere. We have to tell the truth to some persons, and these persons appreciate when you tell them the truth.
Okay, thanks.
Yeah, thank you, Kyrillos. That's a Greek name, eh?
Yeah.
Good. So, do you want, somebody asks, what will we learn about CST today? I had the invitation to speak about craniosacral therapy. I told you a little bit about how we can implement and what we can do, how is the session. It's not easy for me to teach you online first, I can tell you about theory, but I cannot teach you something practical here, also because it's regulated by the international Appledger International, and I cannot teach like that, in an audience that I don't know. And if I teach something, I want you to be, to have the theory and have the practice together. So right now, I will not teach you anything, a special technique from craniosacral therapy, but what you learn is, let's say, how it started, what you can do, what are the benefits, what is craniosacral therapy, what is craniosacral rhythm, and this is the most important things. If you wanna learn more, we will have the opportunity to have more of online presentations. Also, we will do the online course, the hybrid course. So I'm open for any people that they want to learn more, to teach them, to be their teacher. Thank you for the question.
Thank you,
Okay.
Doctor. Just wait a second. Thank you so much, Dr. Kyriakos, for your great presentation and for sharing your deep clinical experience with us. We truly appreciate your time and valuable knowledge in craniosacral therapy. It has been a great honor having you with us today. Thank you.
Thank you so much. I wanted to just tell you that I really appreciate the time with you. If you want to stay in touch, you can visit my website, apledger.gr, for all the courses that we do. There's also information in English language, except Greek. You can send me any emails with any questions, any clients that you have, any cases, any other questions about craniosacral therapy on my email, info@upledger.gr. And I would like to connect with you in my Instagram. So it's upledger-baral, which is baral. It's the other technique that we will see, I think, in one of the next days, and we'll talk about more about visceral manipulation. So thank you all for staying this time so late, and all your questions that are very valuable. I really appreciate the hosts that they invited me, and I will be happy to share with you even more. And today, which is 7th of July, is my name day. So we celebrate in Greece and the name day. So I'm really enjoying being with all of you today.
Okay, Doctor. Thank you.
Thank you. Thank you too.
جماعة، حد عنده أسئلة تاني ولا خلاص كده ننهي الميتنج؟ Anyone had any question? It's okay, Doctor. We can end the meeting now.
Okay, thank you. End the meeting. I'm leaving. Bye-bye. And see you next time. I think it's on Saturday. We will speak again, okay?
Okay, Doctor.
Have a nice day.